So it's really cool to hear that a 2-year-old got into Mensa recently as the world's youngest member, at least thus far. Let's talk a little bit about IQ testing and kids. Hi out there, this is Dr. Brett Pearce, child psychologist, coming at you with another educational video. This time we're talking about a fairly easy subject to talk about. Normally I talk about fairly controversial things about parenting and things like that, but IQ testing and kids. So it's been in the news that a 2-year-old girl who has an IQ apparently in the late 140s, which is a very high IQ, was recently admitted into Mensa. I believe their usual standard is something like 98th percentile, which is way up there, basically meaning, you know, you're in something like the top 2% of people when it comes to your IQ scores. Let's talk a little bit about IQ testing. So yes, you can do IQ testing with kids that young. I don't know that I've ever quite gone that little, but I've done IQ testing on 3-year-olds before. In general, testing toddlers and preschoolers can be really unreliable, which is not to say that I'm questioning her results. It's unreliable because little kids that young often have a hard time understanding that they really need to put their best foot forward and really give the IQ test all they've got. That being said, though, high results wouldn't necessarily be questionable because, you know, if the kid can do it, the kid can do it. But low scores for a very young kid might not be accurate because they could be more reflective of kid just not really understanding that they really need to try and things like that. So usually when we're talking about ages, 0 through 6, maybe 0 through 8, you have to be somewhat careful depending on the situation on really banking on the results of an IQ test really truly representing the very maximal that the kid can do. Now let's talk a little bit about some of the purposes of IQ testing with kids in particular. So IQ testing is a very regular thing done by psychologists like myself when it comes to more formal psychological evaluations. We do them just to try to see what's going on with verbal abilities, nonverbal abilities. Depending on the IQ test that you use, there can be indications of attention and concentration as well that will be a part of the IQ test. We look for all kinds of things. IQ tests can help when we're understanding the depth and impact of perhaps a deep speech and language problem, because we'll look at the level of the kid's verbal IQ, particularly in comparison to other things that we're looking at in the test. Attention and concentration measures like working memory and processing speed, which you will find in the Wechsler class of IQ tests, which is the one that I'm the most familiar with and I use all the time at work. It can help us also understand potentially things like whether or not we see evidence of ADHD, although you can't, an IQ test by itself can't really be the thing that diagnoses ADHD, but it will help us kind of understand a little bit more of what's going on for sure. IQ testing is also of use just because it's a very thorough cognitive test when we're concerned about maybe a brain injury or something like that, or the effects of, drug exposure for kids. Like if we're talking about prenatal drug exposure, we'll use it to take a look at what's going on with the kid's cognitive status in that regard. And then certainly we'll use IQ testing when we're concerned about what is known as intellectual disability, where we have a kid whose overall cognitive development is just very behind others. And then, certainly like if we're interested in seeing whether or not kiddo presents for evidence of really, big gifts or advancement cognitively, and maybe we could help talk about whether or not the kid needs specialized programming as a result, then, IQ testing is obviously useful to that. So at any rate, I think it's amazing that Mensa now has its youngest member. I think that's wonderful, and congratulations to her and her family. I just thought folks might be interested in hearing a little bit more about IQ testing, because a lot of people, when it comes to young kids in general, just seem to have the idea that young kids can't receive any kind of like mental health services or diagnoses or psychological evaluation using testing, and that's just not true. It's rarer that kids that young will get those kinds of evaluations and things like that, but I myself will see kids as young as 12 months old, in particular for when there's concerns about autism or other kind of developmental difficulties. So at any rate, I just thought that folks might be interested in hearing a little bit more on the subject of IQ testing and kids. Thanks for listening. This is Dr. Brett Pearce about to sign off. If you haven't already, please consider subscribing by hitting a button down below. If you haven't already, because it really helps out the channel. So at any rate, thank you. We'll see you in the next one. Bye-bye.